afternoon. Thank you for joining us. First, I would like to reiterate my statements over the past 2 days about the reprehensible behavior displayed by protesters at the homes of our public officials and the individuals who deface the Anne Frank Memorial. These actions are nothing more than bullying tactics that seek to silence our right to free speech should not be used to intimidate and scare others. There is no place for this behavior in Idaho. We must remain respectful and calm so that we can get through this pandemic together. By now, all of you know someone who has been infected with COVID-19. Many of you have had it yourselves. Some of you have been fortunate to experience mild or non-life-threatening symptoms, but others have not been so fortunate. More than 100,000 Idahoans have contracted COVID-19 since March, and thousands have been hospitalized, barely able to breathe, and some with severe complications. These are people who have technically recovered, but who lost time at work and face mounting medical bills. Some of them will deal with long-term health issues, such as heart problems, fatigue, memory lapses, and chronic digestive problems. Sadly, more than 1,100 of our fellow Idahoans have died from this dangerous and highly contagious disease. COVID-19 is now the third leading cause of death in Idaho this year, trailing behind heart disease and cancer. And COVID-19 was the number one cause of death in Idaho in November. In multiple counties, the morgues are full, and they are starting to ask for refrigerated trailers to hold bodies. In some parts of the state, emergency calls for COVID-19 victims are up 300%. Portions of EMS staff are out sick, delaying the response time for all of those in need when they call 911. The backbone of a strong economy is a healthy citizenry. Idaho's economy is open, but businesses cannot effectively operate when their workers are out sick and their patrons and customers are fearful. Idaho's schools are open, but they cannot effectively operate if teachers are out sick and students are quarantined. And importantly, healthcare access for all of us is diminished when healthcare workers are out sick. The vast majority of Idaho's hospitals are being pushed to their limits. Too many healthcare workers are out sick with COVID-19 or in quarantine due to exposure to the virus. And too many very sick COVID-19 patients are coming through their doors. The goal of the pandemic response has always been to elevate and preserve healthcare capacity so that we can continue to be healthy and have access to the care when we need it. We have done a lot in that front. In the spring, we responded quickly to equip our hospitals and clinics and first responders with PPE and staff to handle the influx of patients. We expanded access to medical professionals by lifting regulations at the state level and facilitating staffing contracts with federal sources. Through our actions, out-of-state medical professionals and retired or inactive practitioners may treat patients in Idaho. Since March, we've licensed 1,100 new nursing professionals to help in the fight, and we have gotten nursing students to start work faster to help our hospitals. Use of telehealth has risen by 40-fold after we roll back dozens of regulations, and I signed an executive order that will make those changes permanent moving forward. We allocated and distributed new and effective treatments for COVID patients. We put more than $100 million into testing and contact tracing. We've increased testing lab capacity and testing in schools and long-term care facilities. We've enabled pharmacists to administer testing in our rural communities. We've designated 6 long-term care facilities as COVID-only facilities and put millions towards testing of facility workers to better protect their residents. And we activated the National Guard to staff Idaho's hospitals The Guardsmen were deployed across the state to help with testing, decontamination, and sanitation and planning. These dedicated Guardsmen will be critical in vaccine delivery. We are marshaling all our forces, and yet the enemy, this plague, continues to advance. It would be hard for anyone to say the state of Idaho hasn't done all we can to prepare our hospitals and elevate capacity. And as part of our safe and responsible rebound plan, Idaho will need to remain under a Stage 2 statewide public health order. The order requires strict limits on gathering sizes based on an emphasis from public health officials on the need to curb transmission at gatherings and crowds where people tend to let their guard down, and distancing and masks. Physical distancing is required. Seating only is required at bars, restaurants, and nightclubs. And there is a mask requirement for long-term care facilities. Idahoans are also encouraged to telework as much as possible, and employers should continue to make special accommodations to protect at-risk employees. In addition, the protocols put in place by the state for businesses and employees and patrons continue to be an effective tool to help mitigate the spread of the virus. The number of available intensive care units is something we track closely. Hospital ICUs are typically not full in normal times. Some beds are occupied by patients who are recovering from a major surgery or have had a heart attack, stroke, trauma, or other conditions that require around-the-clock care from highly skilled medical staff, the stuff of normal day-to-day life. But these are not normal times. The addition of COVID-19 patients taking up ICU resources and staff has pushed capacity to nearly full. We are fast approaching a point where we simply may not have enough beds, critical care doctors, nurses, and technicians to handle the number of COVID-19 patients in need of care. My fellow Idahoans, we should all care about the situation in our hospitals right now, regardless of our views on COVID-19 and the pandemic response. When hospitals must cancel routine procedures to handle the stresses within their walls, we all lose access to the care that we need. And if the state of Idaho must activate crisis standards of care, you or someone you love may be turned away from the hospital or given a lower standard of care because there are too few resources to go around. We are not there yet, but this is something our state has never had to do. Crisis standards of care describes a healthcare situation usually brought on by a draconian natural disaster, like a hurricane, earthquake, or flood. The state of Idaho must activate crisis standard of care during a disaster that overwhelms the healthcare system across a broad geographic region, and its resources cannot be obtained quickly enough to address the shortage. The Crisis Standard of Care Crisis Standards of Care guides decisions about how to allocate scarce resources, such as hospital beds, medications, or breathing machines. The goal of Crisis Standards of Care is to save as many lives as possible, even when the odds are stacked against us. In the time of COVID-19, here is what it means to you and your loved ones if we reach that point. If your son or daughter gets in a car accident, a hospital bed may not be available for your child, or your child will have to receive care in a repurposed conference room. Your child may have to wait for a procedure to repair their injury until care returns to normal. If your wife is diabetic and has had an infection, she may not get a hospital bed. If your husband has a stroke or heart attack, paramedics may not be able to arrive quickly, leaving him to wait longer for help. Breathing machines or ICU beds may need to be directed to those patients who are most likely to survive, because there aren't the staff to run them, while patients are deemed less likely to survive may not receive one. I want to commend our hospitals across the state for working around the clock to share resources so we can avoid this devastating situation as much as possible. From my heart and from all Idahoans, we express deep appreciation to our doctors, nurses, and other medical staff who are overworked and pulling extra shifts to help in the fight. You are true heroes. However, these same hospitals and healthcare workers are telling us the need for crisis standard care will arrive in Idaho if we cannot reverse the trend of our rising COVID-19 cases. I want to address the folks who think COVID-19 is no big deal. Regardless of how much you call into question the recovery rates, the death rate, how many cases and deaths are counted, and other topics, the situation in our hospitals right now is not something you can debate. The hospitals aren't fudging the numbers. They have absolutely no incentive to make our current situation seem worse than it is. The problem facing our medical facilities is real. We remain at a dangerous precipice. If we cannot collectively and individually do a better job to slow the spread of this virus, this situation will affect you personally, whether you get COVID or not. There's a lot of noise out there. When it comes to my position as governor, there are just as many people saying Idaho is doing too little as there are people saying we've done too much in our pandemic response. My administration and I will continue to the job of ensuring hospitals are equipped with the resources they need to avoid crisis standards of care. We will continue to improve access to testing. We will continue to move towards broadly available therapeutics and a vaccine. Those things are the responsibility of government, but government alone is not going to solve our problem. The solution is each one of us and our personal choices. Our success or failure comes down to personal decisions to protect our loved ones and to exercise personal responsibility. Our individual choices can prevent the need to ration health care in the coming weeks and months. Please make the right choices. Choose whether to wear a mask when you're around anyone who's not a member of your household. Choose to avoid gatherings and keep physical distancing between you and others. And if we all choose to love our neighbors and to do a better job, we'll be able to protect lives, protect our workforce, protect our economy, and protect our children from falling behind. As we approach Christmas in this unprecedented time, I pray and ask that each of us choose to love and protect our neighbors and loved ones. I want to introduce my guest today. Jason is in his 40s. He lives in Twin Falls with his family. He got COVID-19 and was out of work for weeks, isolated from his family. Please take his story to heart. If you think COVID-19 only affects the old and health compromises, Jason's story will convince you otherwise.
Thank you, Governor. First and foremost, thank you to everyone for allowing me to share my story. That's correct. I'm a middle-aged 40-year-old man, and I was affected severely by it. I did not take it that serious. Really didn't believe in COVID-19 in the beginning. But my mind changed and my thoughts. COVID is not a joke, and it's not a flu. It's much more serious than that. I was definitely the unlucky one. I know there's a lot of people that have been no symptoms and have never been affected by it, even if they had a positive result. But mine is a story about, being a very healthy guy and it affecting me seriously. I was out of work for weeks. My family was affected. My wife works in the medical field, and so she had to kind of take her precautions and be quarantined. We lived apart for over 10 days. which kind of, very stressful for our children, just our relationship, and living completely in another building on our property is never fun. As far as my job, I was affected severely just being gone for that long, not being able to participate with my team and do my part here at our workplace. I guess my true take on it is I truly feel for all the individuals that are affected by this disease. Once again, not a joke, not a flu, much more serious. So, if I can pass on anything with my story, it's to help comply with some of the standards that are being put into Idaho so we can save our businesses, keep our state open, and most important, keep everybody healthy. Ending this thing, hopefully quicker than longer, is going to be our survival. I personally have lots of friends and family that run small businesses around here and across the state, and my heart bleeds for them with their businesses going down and losing revenue. Just don't want to see that, and sure hope that we can put this thing away, and it's going to take all of us together to help comply with some of that. I really feel like my story, I'm a simple family man in Idaho with 2 kids and a beautiful wife. And I feel like my story is one of them that, I just didn't take it serious. And so that's kind of my goal today, to pass on to everybody that, I was an unlucky one. You don't have to be. You possibly may be having no symptoms, but complying and helping will help stop the spread. I just wanted to appreciate all the help and the support from everybody. It's been very important to pass this message on. I felt like my story was an important one to share. Thank you.
Thanks, Jason. My next guest is Kristen Conley, an RN in the St. Luke's ICU. She will share with us what she has seen and experiencing as a frontline healthcare worker.
Hi, yeah, my name's Kristen, and thank you, Governor Little. And Jason, I'm so glad that you got home, and I'm so sorry that you had to go through all of that. That's a harrowing story for sure. I have been an ICU nurse for over 25 years, and in that, over 24 years, and that may not age myself too much. And in that time frame, I have seen a lot. I've seen a lot of suffering and a lot of what can go wrong, whether it's from accident, trauma, illness, complications from surgery, stroke, heart attack. And I have seen so much suffering. And in all this time, I have never seen anything that looks quite like this. A few years ago, when we went through the epidemic of the H1N1 swine flu, that was overwhelming. That was hard. It was sad. It was heartbreaking. And this virus is distinct. This is a pandemic, and this virus is highly contagious and widely catastrophic in a way that we didn't see with the H1N1. So they're very different situations. What I hear a lot out in the community, and I think Jason touched on this, is a lot of people saying, well, this is not my reality. And that's a common feeling. Like, as human beings, we do tend to form beliefs and ideas based on how we perceive and look at things and what our experience is. And that doesn't necessarily make your reality the truth. And the truth is, we are in a pandemic, and it's a serious, devastating situation and catastrophic for so many people. And I want to share with you what my reality is as a frontline worker in the intensive care with the sickest of the people, those who are suffering at the greatest degree, what that looks like on our side. The reality is I see illness and loneliness and fear and isolation. I see so much suffering. And this is patients of all ages, from people in their 20s to their 90s. And there's not necessarily a rhyme or reason, like Jason touched on, who does well and who doesn't, and who can survive and who doesn't, and how well they do once they do get out of the hospital. And that's a scary notion. Several weeks ago, I took care of a mom, and her youngest is a year and a half old at best. And she fought really, really hard to live. And she got to the point where she required everything we could throw at her. She was put on the ventilator. She had all the IVs and the infusions to keep her alive, the wires, the tube, the monitoring devices. We flipped her onto her belly. We flipped her back. We gave her everything at our disposal to help her survive this. And she fought. And she fought so hard, and she fought for every breath that she took. And in the end, we couldn't save her. And in the end, she couldn't go home to her family. She couldn't go home to that baby who will never remember her mom. This is one story. And you can walk into this COVID ICU and you can go from room to room to room to room. And you can see this level of suffering and fear and isolation and worry and loneliness, story after story. And I share this story with you because she matters, and every story matters. And as these healthcare workers, we carry these stories with us, like in a pack, these stories that we haul around with us every single day. I think of this mom every single day because I feel like I owe that to her to honor her life, because she is not just a number. She is not just a COVID statistic. She is a mom and a wife. She's somebody's daughter and sister and friend. And every life counts. It matters. It matters what we do. And why do I go into this? Why do I share this with you? Is it to scare you? Is it to upset you? It is absolutely not to do that. It is absolutely to call to you to think about what we are doing, to think about who we are as a people. We are a people that care about our neighbors. We care about each other. Recently, we had a 7th grade middle schooler named Stella send us a thank you card. So Stella, if you ever hear this, we loved it and appreciated it so much. And her little message, I'll just read a little line from it. She said, "Thank you so much for carrying our community through this virus. Thousands of people would not be here today if it wasn't for you guys." And Stella, thank you. And where that is true, healthcare workers have been able to save thousands of lives. We are limited to helping those who come through the door and need us because they're too sick to get well on their own. The reality is, when we unite together as a whole community, we can literally save hundreds and thousands of lives. And we can do this. Yesterday alone, we lost over 3,000 lives in the United States. That is more than what we lost on 9/11. And I remember that time when the nation came together as a people in a way I'd never seen before and never seen since. And it was so beautiful. And I think of what we could do together as a people, united together in this cause, in this fight against the virus. That is how we are going to reclaim our life. That is how we can do this, is by doing it together, by making those behavioral changes of wearing your mask. We wear it for 13, 14 hours straight. You can do that. It's okay. And when you're at home, you can take it off. It doesn't ruin everything. Wear your mask, wash your hands, stay physically distanced, do these things. And we can slow the spread of this virus, and be kind and be a good neighbor, be a good person. Do this and take care of each other, because I know that's who we are. I know that's who we are as a people. And this is how we will reclaim our life, is by doing it together. And that's what I wanted to share. Thank you.
Thank you so much. Next, we have Dr. Robert Scoggins from Kootenai Health in Coeur d'Alene. Dr. Scoggins is a pulmonologist, and he will share his knowledge of how COVID-19 affects the body and the stresses their facility is facing now.
There we go. Thank you, Governor, for giving me the opportunity to speak today. My name is Robert Scoggins. I'm a pulmonary and critical care physician in Coeur d'Alene, Idaho. I have been practicing pulmonary and critical care for about 15 years. I've been in Idaho for about 5. Kootenai Health is a medium-sized hospital. We're the regional referral center up here. We take transfers from all of our critical access hospitals in North Idaho. We perform heart surgery, neurosurgery. We have a big oncology program. We're a trauma center. We perform orthopedics, neurology, stroke services. Before this pandemic, we were very busy. We had a very a full hospital most of the time. And now with the pandemic, it's much worse. I would say that from a clinical perspective, I would agree with what's been said previously. This is not the flu. This is not like a virus I've ever seen. We have dealt with H1N1 in the past. I was practicing medicine during that pandemic, and this is much different. The number of patients that we have and the severity of illness that they have is much greater. I just rounded on 10, 12 patients in our COVID ICU. It's amazing to me, as someone who's been doing this a long time, to watch somebody's oxygen saturations drop just by sitting up in bed from a normal 90, well, a low normal 90 to 92% into the 60s and 70s. And just getting out of bed for these people is dangerous. It's been amazing to watch also the number of people who've come in and felt pretty well and then progressed in our hospital. And then they develop worsening symptoms, and hear their stories of how they were at home, felt bad, thought they were doing okay, and then present to the hospital with low oxygen saturations. We've gotten many through the hospital, but obviously there's been several that have died. Also with the flu, we rarely see long-term effects. Yesterday, I was asked to look at a CT scan of a woman who was in her 40s, had COVID 6-8 weeks ago, and had a CT scan for another reason. She had these changes on there, which I think are chronic changes related to the COVID infection. I'm not sure how that's going to affect her in 1, 2, 3 years. What kind of long-term lung damage she has, and if she's going to have chronic respiratory failure or develop an interstitial lung disease, which may shorten her life or affect her life forever. From a hospital side, I've been the lead clinician, physician leading our COVID-19 response since last March. I've been in innumerable meetings and planning sessions determining how we're going to respond to COVID-19. In the beginning, we met and did what every other hospital did, was close down to visitors and shut off our surgeries and all of our elective procedures. But really nothing happened initially. It wasn't until the summer that we saw our first surge of patients. In North Idaho, when the weather gets good, everybody gets out and a lot of people come to town. And we saw quite a few patients. We had developed a 4-stage plan and it worked well. I don't think we ever got out of stage 3 during July. That plan was to increase our ICU beds and to increase our hospital beds so that we could take care of of COVID patients. And we tried to continue to do our other services because those patients don't go away either. The normal diseases that we see are still there and we have to take care of them. We're now in stage 4 of that plan. We have expanded our ICU. Outside of the ICU, we've added ICU beds. We bought beds so that we could take care of more patients. We've bought monitors. We've changed multiple policies. We have a COVID unit that's essentially where you wear your PPE all the time. That's as of today, we had 72 patients with COVID in our hospital. Most of those on our COVID unit, 16 of them in the ICU, in 2 different ICUs now. And the capacity issues are straining our system. Sometimes it's beds, sometimes it's nurses and staff. We don't have staff because they're either out sick or with COVID, or we just have too many patients. We've hired over 40 travel nurses to help within the ICU alone. And that's been a blessing that we've had them so we could take care of more patients. But honestly, most of the time they're filling in for our nurses that are already sick. We have bought more ventilators, high flow systems, BiPAP, so that we can take care of these patients and keep their oxygen levels up. We've seen patients in our ICU from every decade of life, from people in their 20s up into their 90s. The majority have been over their 50s, and the sickest patients, some of those sickest patients have been in the 30s and 40s. The majority of the deaths that we've seen have been over 50 years old. We're averaging about 10 admissions a day of COVID patients at this point, and these seem to be going up. We see our numbers in our community going up. At some point, and I'm not sure when, but I'm concerned soon that we will not have the resources to continue all of our services that we provide to the community. Our staff is becoming fatigued and burned out. We've been doing this for a while now. We've had our COVID unit open since about September, I think. And it's a hard place to work. You're in PPE full time. It's hard to hear each other. We're either wearing N95 masks or cappers, which are helmets to reduce the risk of spread to our staff. However, I would say that our nurses and respiratory therapists have stepped up to the challenge and have been incredible with their compassion and providing the care to these patients. It's been amazing to see them do that. I think every day we kind of struggle with how we're going to continue doing what we're doing. We meet on a regular basis to see if we can continue to do our surgeries that are scheduled, and what we're going to do. We've had to transfer patients at times to other facilities. For us, sometimes that's Spokane, sometimes it's been to Boise or even Seattle. We have been challenged on a daily basis at this point. And at some point, I'm concerned that we won't have a place to send these patients. And as Governor Little has spoken about, that's when the crisis standards of care become important. And me personally, I would like to avoid that. I think that we're ready for this to be over. Never really wanted it to happen. And we don't get to ignore it in the hospital. These patients they come and we have to take care of them. And we can't deny that the virus exists. We have to deal with the patients and take care of them. Thank you.
Thank you, Doctor. Now we'll take your questions. Scott Logan. Go ahead, Scott.
Hello, Governor. Can you hear me okay?
I can hear you fine.
Sir, how would you react to those critics who say that you have essentially abdicated leadership by putting all of these difficult decisions, such as the wearing of masks, on the shoulders of local leaders?
Well, that's state law. It actually has been for 100 years in Idaho. Originally it was the counties. In the last 50 years, it's been the health districts. That doesn't mean that it doesn't elevate up from the cities to the health districts to myself and Director Jepson. But state law, it defaults, these issues start there at the health districts.
Thank you, sir.
Melissa Davlin.
This is a follow-up to Scott's question, Governor. With respect, I've sat through all these press conferences and I hear good news from you about the economy and all of these things that you're doing by calling the National Guard, or all of the efforts that the hospitals are taking to hire more nurses. And meanwhile, these local officials who don't have the resources or frankly the security that you do are making these difficult decisions. And I mean, that goes to even the declaration of crisis standards of care, which is on the director for the Idaho Department of Health and Welfare. So with respect, what difficult decisions are you willing to make as we get closer and closer to those crisis standards of care? Where does the buck stop?
I guess I didn't do a good enough job of going through the list of all the things we've done. We've done a lot of things, and in fact, I don't know that there's anybody that's been a bigger advocate for changing behavior. What I want is compliance, and we're just having an issue. Of my top 10 counties, the ones with the worst numbers today, 60% of them have some kind of a mandate. That's the issue with the mandate. And in some areas it's working, but in some areas it's not. But what I want is compliance. My goal is to get compliance. That's why we've changed our messaging. But we have been talking about it since last spring about what behavioral modifications people need so that we can keep the people of Idaho safe.
As a follow-up, Governor, thank you so much, but nothing is changing from the last time you addressed the state in a press conference capacity a month ago. And so do you really think that Idahoans are going to change their behavior now with nothing substantial changing in the public health order before we hit that crisis standards of care?
Well, if you look at the chart behind me, there's a lot of things we've done as far as increasing healthcare capacity. There's a lot of things what we're doing as far as making things available. And we're doing a lot of what we're doing on messaging to try and get people to comply. I've got counties that have got mask orders local by the people they know right there, and there's no compliance. I'm trying to help the messaging, whether it be a school district, whether it be a county, whether it be a health district, to get that compliance that we need. But we've done a lot of things to increase healthcare capacity. And every state around us is having the same problem.
Thank you, Governor.
Betsy Russell.
Governor, to follow up on Melissa's question, you said that you've got counties that have mask orders and there's still no compliance. We've also seen local officials really being intimidated, often by small groups of very noisy and outspoken people, some from outside their local areas, when they attempt to put in place mask orders or any other type of method to respond to this virus. Going back to Scott's question, you said it's state law that this defaults to locals, but it's certainly within your power to step back in and issue statewide orders as you did during the initial part of this pandemic. Why are you not willing to do so at this point?
I will re-emphasize over and over, I want compliance. It is absolutely abhorrent what people are doing to some of these, whether it be a school board, whether it be a health district, whether it be a county or a city. Anybody that's in authority, it's abhorrent what people are doing in these areas. And I wish all those people who are showing up would have heard what Kristen just told all of us about the magnitude of this problem. We are changing the messaging. We're putting out more resources. But what I need is compliance. And I firmly believe that compliance will be better if your local school board or your local health district or your county commissioner or your mayor advocates for it. I do not deny for 1 minute that there's incredible stresses on everybody from one end of the system, from the healthcare providers to all the people in authority that have something to do with trying to change behavior. But what I need is for people to do the right thing. And we've got counties, we've got states, we've got areas that have got all kinds of orders, and their numbers are getting just as bad as ours are, some at a little different rate, but that is just all too common. And we're trying to message the magnitude of the problem. We anticipated when kids got back in school, when people went inside, when the flu season started, when Thanksgiving got here. We anticipated this, and we're trying to do all we can to keep our healthcare capacity above the infection rate.
But Governor, given all that, it's not worth it to you to also add any provisions to your existing public health order?
We made a change 2 weeks ago. We're constantly looking at it. We're constantly monitoring the data about what's out there, but I want to get things done. It's not check the box, you did this. It's what do I do to get people to change their behavior?
Governor, how close are we to activating crisis standards of care in Idaho?
Well, it goes up and down. You heard the doctor talk about it, what it is, and it depends upon where you are. We have significantly increased the collaboration, whether it be through our long-term care facilities or our hospitals, about creating COVID-only wards, about taking people that normally would be in ICUs for a longer period of time and maybe moving them somewhere else. We're on calls with the healthcare industry day and night about what we can do to help them, and frankly, it's to their credit for what they're doing to increase healthcare capacity.
But are we days away, weeks away?
I can't tell. I can tell you, if everybody would have heard Kristen talk a little bit ago, that date will move back.
Thank you.
Ruth Brown.
Good afternoon, Governor. I appreciate your time. You just reiterated something that you've been saying for months, that you want to leave this to local governments and local authorities, local health districts. At least 2 board members with the Central District Health have asked you to take action. As you know, yesterday they were, or I'm sorry, not yesterday, but the other night they were set to discuss a public health order that would theoretically prevent the spread of coronavirus, or at least make an effort. And they quite literally cannot meet because it's not safe. They're asking for your help. Will you help them? I mean, they quite literally cannot do their job, cannot implement that public health order. Will you help them?
Yes.
How so?
We're trying to get compliance. Their goal and my goal is the same, is to get the incident rate down and the hospital capacity up. Everything we're doing is to try and get that done. But and it isn't that I want to dump it on the schools or dump it on the health districts. It's the fact that I believe compliance will be better if it comes from the local level that has been the policy of the state of Idaho for 100 years. Granted, I'm not denying that I do have that authority, and I haven't said I wouldn't use it at some point in time, but the secret is compliance. I want people to comply, to voluntarily go out and do the right thing, whether they're under an order or whether they're not under an order, to get the incident rate down.
Sure, but what I'm saying is Central District Health, they're not planning to ask nicely. Their order would mandate it, and it would be punishable. Whether or not it will be enforced, who actually knows? But they're at the point where their hospitals are so full that they want to mandate it, and they quite literally cannot meet to do that. So when I ask, will you help them? I'm asking, would you support them in their effort to move forward this order by,
Ruth,
theoretically, I guess you have the authority
Ruth,
to do it yourself.
Ruth, is there one instance where I said I wouldn't support them? I don't believe there has been. I believe I've been as supportive as I can, particularly these health districts that are really doing the hard work. Health districts, school boards. I was on the phone this morning with school superintendents from all over the state. The question is, will I support them? I don't think there's any evidence that I haven't supported them. Don Day.
Governor, you mentioned that there's a lot of noise out there, but I think this is signal. Joel Poppin is Micron's general counsel and on the company's board of directors, big player in Idaho for decades. This morning during an address with Boise's mayor, he said of the events of the last 2 days, including those protests and the issues that Ruth talked about with the health board, he said, quote, "Those kinds of bad actions impact our ability to recruit and retain talent and threaten our growth, prosperity, and longevity in Idaho. We've heard from other businesses leaders with similar concerns. What's the state going to do? You do, to ensure these actions don't prompt Micron or other companies to leave and prevent other businesses from locating here?"
Well, I don't want Micron to leave, but much more important than that is the fact that it just speaks, it speaks volumes about a certain segment of society that just shouldn't do what they're doing. I condemned it originally, I condemned it at the beginning of this, and we will do all we can to protect those public leaders, public officials that are out there on the front line, but more importantly, the dignity and the civil rights and the what's represented by that Anne Frank Memorial is something that is very important to me and very important to Idaho. And we'll condemn it, we'll enforce the law, and hopefully, and I believe they will, if I know the people of Idaho, they will react in an equal and opposite reaction about how absolutely abhorrent that activity was. And I believe if we do that in Idaho, those companies will not have a problem. But I fully understand where Joel and Micron are coming from. But the issue isn't what it does to Micron. The issue is what it does to the heart and soul of Idaho.
Governor, I've been around a while, and so have you. And that memorial, the only one of its kind in this country, came as a direct result of the problems that we were having in North Idaho in the 90s. And they were concrete steps taken by business leaders, by governments and others to say Idaho doesn't stand for this. You know, I hear you're saying you're going to support it, but what are those actions? We've got some pretty serious challenges in our state right now.
Well, one of my mentors, one of my heroes, was a Holocaust survivor, Rose Beale. And the minute I heard of that, I thought of my old friend Rose Beale. And when she would go into schools and go around and tell her personal stories about what happened in the concentration camps and what the Nazis did. That's the story we need to be talking about. I will condemn it again. I've condemned it multiple times. That's what we're doing. But I think what's more important is the community come together and say this is totally unacceptable in Idaho. Rebecca Boone.
Hi, Governor. You've talked about the state being on the verge of crisis standards of care, which means that our state is on the verge of a humanitarian disaster. You've also said you think compliance for things like mask mandates would be better if it comes from local leaders. But I think most health experts at this point would say any increase in compliance would be probably better than our current trajectory, the status quo. So I guess what I'd like to know is, do you think taking additional steps such as a mask mandate from you at the statewide level would actually cause harm? And if so, would that harm be worse than entering the crisis standards of care?
Well, Rebecca, I talk about this. We look at this every day. My friend Governor Herbert and the new governor-elect in Utah, Spencer Cox, I talked to them. We've been looking at their numbers. They put in a mandate, and frankly, it didn't change much. But and there's a lot of nuances because of the seasonality of it. But we're looking at that. But I still believe that if people choose to do the right thing, you know the independence of Idahoans, particularly compared to a lot of the other states that are around us. If people choose to do the right thing, the question is not if they have a mask with them when they go to an event. The question is, do they really believe that the proper use of this, the distancing, all those other hygiene areas are in their best interest, in their community's best interest, their kids' best interest, and the economy's best interest? Then I believe that's the pathway we should take. But no, we look at this every day.
So as a follow-up then, do you believe that a statewide mask mandate from you would actually cause harm to our current trajectory?
Well, in all honesty, most of you that are asking the questions live right here in the Boise area. I'm very familiar with the totality of the state, and frankly, orders coming from Boise, Idaho, the interest in compliance dwindles significantly the further it gets away from the Treasure Valley here. And so I have to look at healthcare capacity for the entire state, and that means I need people to choose to do the right thing.
Again, my question is, do you believe it would a statewide mandate from you would cause harm?
We are looking at it.
What's the metrics for that?
Compliance.
No, I mean, at what point do you say we are too close to this humanitarian disaster, I'm going to issue a mandate? Is there some sort of number or metric you're looking at?
Yes, there's a metrics, but there's lots of metricses.
Can you elaborate?
Audrey does.
Hi, Governor. I asked about this at the last press conference. What are you doing to help healthcare workers get through this pandemic when, like Kristen Connolly, they're carrying the emotional weight of every patient they lose? And, you know, along the same lines, if people don't comply with the prevention that you're asking them to, which we've seen they're not doing that, what is your plan to help hospitals and help healthcare workers out with this? When travel nurses cost upwards of $6,000 a week, that's not affordable for a small hospital. They are all slammed. What is your plan to deal with the mental health impact for healthcare workers and to keep things from getting to a point where it's impossible to manage anymore?
Well, I mean, the community spread throughout really the United States, with the exception of a few areas, is something that's a challenge for all of us, all of the governors and all the people of the state of Idaho. We just recently put an additional $5 million in to help hospitals to address this, but I ticked off a liturgy of all the things we've done to allow retired healthcare workers, people that aren't licensed yet, to bring people in from out of state to reduce licensing friction. And we are in constant contact with long-term care facilities, with hospitals, with clinics about what we can do to help. This isn't something that I just do on a random basis every several weeks. These are conversations that take place between myself, the Department of Health and Welfare, and the health districts and the health professionals every day.
I understand that. Since the pandemic started, I have had 2 nursing sources leave the profession or quit their jobs. So we are also losing healthcare workers who feel as though it is being put on them to deal with this. Well,
again, you heard me talk about my, and I believe the whole state of Idaho's, compassion for those frontline healthcare workers. But we've also got frontline educators that are on the front line. We got people working on long-term care facilities. There's no question everybody in the healthcare facility, from an elementary teacher that's taking care of kids to the doctor in the ICU, everybody's having stress. But the healthcare industry is basically the bleeding edge of this pandemic, and we're trying to do all we can to help them in every way, shape, and form. James Dawson.
Hi, Governor. Thanks for taking my question. What do you think that it says about us as Idahoans if your administration has to authorize crisis standards of care after your administration and the state has had months to prepare and digest the science and put out these public relations campaigns about these prevention lessons that we could have taken in from other parts of the country and the world?
Well, it says that we're in a global pandemic, and the entire healthcare system in the United States is at risk. When this started in March, it radiated out of the Washington area and the East Coast, and then it kind of rolled around the United States. But there was kind of an indication then that we'd have a surge in one area, and then there'd be, as that surge went down, it would go somewhere else, and we'd have healthcare capacity. I was on a call with a significant number of governors in the last few days, and the critical issue is it's everywhere. What should have been hopefully freed up healthcare capacity in one part of the nation to help somewhere else has just gone away right now. You heard the doctor talking about diverting patients from Coeur d'Alene down to Boise and from Coeur d'Alene to Spokane and Seattle. This is a critical issue everywhere, and we have done an enormous amount of planning, and all those things that are on that chart behind me talk about the different things we've done to try and make it to where our healthcare capacity can handle the surge. But as I just alluded to, this is getting critical right now, and I need people to choose to do the right thing so we can maintain our healthcare capacity.
It's true. You're right. It is a significant issue in many states across the country, but not many states have had to implement crisis standards of care. Why have these lessons and your public relations strategy seemingly not gotten through to people across the state?
If I knew there was one thing to do it, I would fix it, James. That's why I'm still, my heart's very impacted by the message that Kristen talked about. We have got to get this message out to all the people. We know that there's a high percent of the population that are trying to do the right thing. The problem is that we have such wide viral spread that we've got to have a higher percent of the population doing these right things to get those numbers down so we don't go into crisis standard of care. Brian.
Yes, Governor, thank you very much. So you mentioned that orders coming from Boise. I hate to keep going back to this, but you said orders keep coming from Boise, or that do come from Boise, don't go over well across the rest of the state. We've already talked to protests. We've already talked about what's happening, but I mean, even places in Rexburg, Eastern Idaho, Moscow, Coeur d'Alene, anytime a health district tries to get together or a council tries to get together to implement any sort of compliance, they're facing all sorts of adversity. You just heard Dr. Scoggin say they're bringing patients down to Boise. So we're all in this together. You have the authority, as you mentioned, to kind of take a statewide approach to this. Why not take this heat yourself instead of having people feel threatened in their own homes?
If the decision point for me was I take the heat rather than the rest of them, I would do it. The decision point for me is how do I get compliance? That's the critical tipping point for me, is how do I get compliance? If the people in some of those communities won't do what their neighbors tell them to do, you made the point. What do you think is going to happen if that order comes from Boise, Idaho? Okay, Keith Riddler, last question.
Governor, come a budget COVID-19 question. As you know, the state is running a pretty good surplus right now, but your budget chief, Alex Adams, attributed a lot of that to a lot of federal money coming into the state, and that's drying up, with the money individuals and businesses got and the state got, and also unemployment benefits from the CARES Act is ending later this month. Do you see the state needing another relief package from the federal government, and are you advocating for that?
Thank you, Keith. I had a conversation with Senator Crapo about it yesterday. As I said, I've had some conversations with other governors. We've talked to the White House. Senator Crapo said it's brewing back there, and there's some of the people whose benefits are going to dry up the end of this month, and I'm hopeful that Congress will address them. But I got to tell you, we in Idaho are in better shape than almost any other state as financially. And the biggest cloud on the horizon is I have got to get these numbers under control. I've got to get better compliance. I got to get people choosing to do the right thing so that we can go back and take advantage of all that economic prosperity instead of having being diminished by us having to spend extra money in healthcare, businesses slowing down, and kids being out of school. And we have to work through the conundrum of how do we help these kids that have lost perhaps even a year of their academic advancement. All right, with that, thank you all very much.